Alright, y'all, some big abortion and pharmacy news. Research identifies a potential alternative to mifepristone for medication abortion. This is huge. If you haven't watched my contraceptive and abortion videos, there are two medications that we use for abortions. We have mifepristone, which blocks progesterone receptors, and misoprostol, which helps with the expulsion of the matter. Using both together has a higher rate of success versus misoprostol only. Mifepristone is highly regulated in a lot of states. DEHAs in Louisiana actually made mifepristone and misoprostol both Schedule 4 controlled substances, the same schedule as Xanax. I didn't even think that was legal because we schedule drugs based off of their abuse potential, their addiction, and dependency. For those of you that don't know, there are 3 emergency contraceptive options. We all know Plan B, this is over the counter. You can use a copper IUD as an option as well. Here we have Ella or Ulipristal. This is by prescription only and it has more leniency when it comes to weight. Ulipristal or Ella is something we call a selective progesterone receptor modulator. It has antagonistic or blockade effects on the progesterone receptor. This is Ella or Ulipristal and this is mifepristone. Mifepristone blocks progesterone receptors. Remember, they both do this. Blocking progesterone receptors not only inhibits ovulation, but it can assist with pregnancy termination. The hormone progesterone is crucial for maintaining a pregnancy. Up here is Plan B. This is levonorgestrel. Levonorgestrel is also used in lower doses in some birth controls. For example, Vianva or Altavera, it's paired with ethinyl estradiol. Plan B does not cause abortion. Plan B or levonorgestrel is a progestin. So taking this causes something called negative feedback and decreases the risk of ovulation. Ulipristal with misoprostol showed high efficacy and safety for early medication abortion with no serious adverse events reported. Let's look at the study. A proof of concept study of Ulipristal for early medication abortion. New England Journal of Medicine. 60 participants were randomly assigned to either 60 milligrams or 90 milligrams of Ulipristal. Remember, it comes as 30, so this is like 2 or 3. Pharmacists can prescribe birth control in Indiana, in my state. However, we cannot prescribe Ella. This is an exception. We can prescribe Plan B, though. Remember, because Plan B is not an abortifacient. Followed by 800 micrograms of buccal misoprostol. That's in your cheek. So this was first. This was a dose study finding. And then they did an open label study with 100 additional participants. Because the two groups had similar efficacy and safety, they opted for the 60 milligram Ulipristal dose for an open label study with 100 additional participants. So this is a chart for that. Results. Pregnancy termination occurred with the combination Ulipristal 60 milligrams and buccal misoprostol 800 micrograms in 129 out of 133 or 97% of participants. This is amazing. If we look at the baseline characteristics, the participants were up to 9 weeks of pregnancy. I'll mention that mifepristone is used up to 10 weeks usually, 70 days. Again, this is just like a preliminary study for everything. You already know the side effect profile of Ella is pretty good, as you can see in red. The blue is after the misoprostol, so patients are pretty uncomfortable. Remember, misoprostol has a very short half-life, about 20 to 40 minutes. I've mentioned this before, but we usually say 3 to 5 half-lives before the drug is cleared from your body. I have a video in my patient education playlist on TikTok of how to take misoprostol and mifepristone and what to expect.